The Veronicas with Perfect. Welcome back. It is the Country Viewpoint here on your colour of country life, Flow FM. It's time to go back to something that we've been investigating a lot on this program over the last few months, and that is the state of rural and remote medicine. And public consultation on rural generalist medicine recognition closes today. And joining me on the line is Dr. Dan Wilson. He's from the Australian College of Rural and Remote Medicine. How are you, Dan?
Very well, thank you, and thank you for having me.
It's great to be with you. Firstly, just tell us about how significant this is, the state of rural and remote medicine right now, in a bit of a precarious position, not quite where we want it to be in many different sort of facets. So this consultation period, very significant. Tell us more about it.
Absolutely. The Australian Medical Council, that is the peak body that accredits organisations to train future doctors, as GPs or other types of doctors, has been undertaking a period of consultation with various stakeholder groups to determine should rural GPs who provide on-call services to the hospital deliver babies, or these days called rural generalists, be recognised as specialists, and if so, why? And the current phase of consultation that has been open is the public consultation phase, which includes patients, community members, consumers to provide feedback to the Australian Medical Council on why it would be so important for GPs that provide these extra services to be recognised as specialist rural generalists. And consultation closes today, so really limited time to give feedback.
Just so we have a bit of a clearer understanding, Dan, do we have an exact time frame today as to when that will close? Is it just close of business on the Eastern Seaboard?
From the best that I understand from the Australian Medical Council, that closing time will be business hours on the Eastern Seaboard. That's correct.
Okay, just moving on, what is the current state of rural and remote medicine as far as people's access to critical needs go around the country? At what point, do we sort of really try and ramp things up as best we can with, as much government assistance as possible? Because, we've had a lot of advocates come on the program who want to see a stronger workforce in the regions, but it just seems to be layer upon layer of obstacles that prevents this from occurring.
Yeah, you're absolutely right. It does feel like a constant barrage of obstacles and barriers sometimes. I live and work in rural Victoria and inland New South Wales as a rural GP and GP obstetrician. I've seen it firsthand and know how hard it is sometimes to be able to provide care to my communities. I can't service everyone's needs. There aren't enough of me to go around. The whole purpose of this public consultation undertaken by the Australian Medical Council is to be able to re-incentivise what it means to be a rural GP that also provides emergency and after-hours care at a hospital, to reinvigorate to junior doctors what it once meant to be a really important pillar in one's community and re-attract those junior doctors back into those rural areas. Because as many of listeners will know how hard, if they're living in a regional or rural area, how absolutely difficult it can be to get in to see their rural GP, and sometimes even difficult to get to an after-hours service if there's an emergency or have to travel several hours. So this is really important work.
Dr. Dan Wilson from the Australian College of Rural and Remote Medicine. We'll keep him on the line and we'll continue this important dialogue on the other side of these messages. Don't go anywhere. Stacey Orico with Christmas Wish, and welcome back. You're listening to the Country Viewpoint Tuesday edition on Flow FM. I've currently got Dr. Dan Wilson on the line from the Australian College of Rural and Remote Medicine. Doctor, just if you can expand on the recent webinars that have been hosted by the Rural Generalist Task Force through college channels and at events. We know that, we need every avenue possible to try and get an uptick in people taking up positions in the region. So is this one of the ways forward?
This is absolutely one of the means forward to ensure that there can be more rural doctors to serve our communities. This is just one avenue that has been a recommendation from the Rural Generalist Task Force, that is to have recognition of rural GPs providing after-hours and emergency services as specialist rural generalists, which will open up some really interesting ways through which rural GPs can be employed to provide continuity of employment potentially, such that junior doctors then don't have to get a new contract to have a job every single year. But there's a suite of other recommendations that include nationalising general practice training across the country, incentivising that training, and requires significant collaboration between both Commonwealth and jurisdictional governments to make this work.
Just from your own sort of remit, can you paint a picture as to the exact difficulties that some people are facing when it comes to things like, a really sudden illness that they've been diagnosed with and they need to then go to the city to seek treatment for that particular illness? We hear about it a lot in really small pockets of media circles, but there's not really a national conversation that's being had about the difficulties that some people have to endure when they've already been obviously very heavily burdened by a recent diagnosis.
Yeah, certainly. I could recount a story of when I first started to work here in Maryborough in Victoria, a rural community. I was on call, patient came through with chest pain. He was worried he was having a heart attack, and indeed he was having a heart attack. It was late at night. We have no specialist service here. We needed to get this gentleman urgently to a nearby service. There was unfortunately no capability in the two regional hospitals I am spoilt for care, that is Bendigo and Ballarat Health Services at the time, for workforce difficulty issues at the time. This meant that this gentleman had to be put onto a helicopter and flown all the way down to Melbourne for specialist care. And that's a really long time in an aeroplane when you're having a heart attack, to be honest. Thankfully, this gentleman survived. But some of the further ongoing difficulties is simply getting follow-up appointments to see a regular GP in some of these regions. Normally, after a heart attack, you'd want to be seeing your GP within a couple of weeks. In many communities, I'm a bit lucky where I work now, the wait is not too bad for me, but in many rural communities, the wait to see a GP is between 6 and 8 weeks. So good luck trying to get the aftercare that you're meant to be having after something like a heart attack. So part of this public consultation is to ensure that we can re-attract junior doctors to rural communities such that we can increase the workforce to service the community, because there's absolutely an inordinate amount of work for underprivileged Australians.
And is the issue being looked at or followed up whereby you've got people in regional centres, let's say an hour or 2 hours away from a major city in Australia, and a lot of the time if these people are in a state of emergency, they'll be told to, for instance, you're best off driving to the Royal Adelaide Hospital or whatever it might be, and then they're having to deal with emergency departments that are absolutely flooded and lots of ramping going on. So obviously that would then possibly deter the patient. So it becomes a bit of a vicious cycle, obviously, Doctor.
Yeah, I certainly experience that all the time. I was just on call this weekend, and there's a number of patients that came through that needed to seek care, and I was able to provide an assessment. But unfortunately, I have very limited services that I can provide in my small rural community on the weekend. I can do some blood tests, but I actually don't have an available on-call imaging service. So anyone that presents with a potential break to their wrist or ankle or a fracture somewhere else, I can't take any photos. So I actually have to advise people that if they're able to, they need to go down to their nearest regional health service, and then they need to wait in the emergency waiting department of already ramped, clogged emergency departments. So I live this every single day of my life, and it can be really disappointing and heartbreaking to tell patients that. So we really do need to see significant change in the Australian healthcare system such that patients are able to get the right care where they need it, and ideally close to home.
No doubt about it. Dr. Dan Wilson is from the Australian College of Rural and Remote Medicine. We really thank you for being at the forefront of this, Dan, and all the very best with your work going forward. Thanks for your time.
Thanks very much. And the Australian College of Rural and Remote Medicine, thanks for your time.
Dr. Dan Wilson from the Australian College of Rural and Remote Medicine. There's more to come on the other side of this. Stay tuned.